Hipmap is a great product that Stryker has to offer that really revolutionizes how we approach hips.
So Hipmap is a three-dimensional depiction of a hip joint. So what it does is it uses either CT scan or other advanced imaging to be able to recreate a model that is specific to a patient.
One of the biggest issues we have is identifying who's going to do well with hip arthroscopy and who requires an open procedure. Now we have the ability through Hipmap to really diagnose those problems that are treatable with hip arthroscopy versus those problems that will require an open procedure.
I had a collegiate soccer player who had hip impingement. She had broken her femur when she was a teenager, and that had actually healed in a malunited position where she had excessive rotation. And so Hipmap really helped us understand the rotational abnormalities as well, that I think with two-dimensional x-rays you would not have been able to obtain. With MRI, it'd be very difficult to fully elucidate what their femoral torsion was, but Hipmap really helped to understand what we needed to do and that this patient was still okay to do hip arthroscopy in isolation.
It mainly takes the complex amount of information that we have to make decisions about patients, both what type of surgery and then what to do in a surgery. It makes it consumable. And I mention that a lot because that's something I think people can relate to. They'll often say, well, I know that all those angles, I can draw those, and I say, well, do you measure all those? No.
From a preoperative standpoint with the patient, it's been more efficient. From discussing preoperative planning with my fellows as well, and then intraoperatively, it's improved our efficiency because you know exactly where you're going to be going as far as an acetabuloplasty or femoplasty.
The patients like it. I think that they're able to more easily understand what is going on with a hip map than with plain x-rays. And I think that they can understand, based on the three-dimensional depiction and the heat map, where the problem is.
And the graphics are now at a point where it's absolutely beautiful, it's helpful, we can identify those areas that we need to shave, it's color-coded, and so it's really come a long way in terms of allowing us to meaningfully use Hipmap to navigate at the time of hip arthroscopy.
Well, Hipmap gives you the information that you need to get your ideal resection. HipCheck makes that efficient.
And so what HipCheck does is that it gives you intraoperative real-time feedback.
So HipCheck is really an extension of Hipmap, and how do you translate your preoperative templating into intraoperative findings. And HipCheck has a video monitor that's placed just over the patient's chest, so you can see your intraoperative fluoroscopy right in front of you. And so you can tell real time as you're resecting the cam bump how much bone is left to ensure that your alpha angle when you leave the OR is exactly what you intended preoperatively.
HipCheck is going to offer a really interesting and exciting way for us to look at our alpha angles in real time, 6 different views. Once we shave the femoral neck, we can then check those same 6 views and look how that's affected the alpha angle in each of those views.
But the other benefit is the adjustable resection curve that is performed also at the same time in the alpha angle. And so what that does is it highlights that head-neck junction. When you obtain your initial fluoroscopic imaging, it'll draw the outline of the cam deformity. And as you resect more bone, that adjustable resection curve will become less apparent or less prominent.
One of the things that I think will be exciting about HipCheck again is for education, that we'll be able to show the patient when they come back at their post-operative visit exactly what we've done in surgery by showing them HipCheck images.
The bottom line is anytime you enter the OR, you want to make sure that when you leave the OR, you've accomplished everything that you had with your preoperative template. The number one reason why people end up with second hip surgeries is incomplete bony resection. So when you leave the OR, you want to make sure that your bony resection is perfect, that you haven't resected too much or not enough bone. And so HipCheck really translates your preoperative templating to ensure optimum patient outcomes.
One of the things I think is so interesting going forward is this vertical integration that Stryker now has offered us as hip arthroscopy surgeons. We now have a preoperative check in Hipmap. We have the Guardian table, which allows us to spend a little more time doing things like the HipCheck without having that perineal post. And then we have the HipCheck to really check to make sure we're doing the full operation, getting rid of the entire cam and not leaving anything behind.
These three products also move the entire field forward, to the fellow just starting out in practice or to the medium volume surgeon. There's also a lot of benefit to the high volume surgeon. And so again, it's all moving us forward to what is a a better indicated, safer, and more efficient procedure.
Both the Hipmap and the HipCheck really gives a comprehensive outlook in terms of how it is to treat the hip, and really pushing it forward. I think in partnering with Stryker, that they have a really progressive way of approaching the hip. I think they really try to think outside the box in terms of trying to make this procedure better and more accurate, and ultimately better for surgeons, but more importantly and most importantly, better for patients.